Good evening, everybody. Welcome to our FP Live today. I'm Dr. Mamta Dighe. I'm the director of Xenith Advanced Fertility Center. We are an advanced infertility and IVF center located in Pune. We are at two locations in Pune, in Wakad as well as Koregaon Park. We have done many FB lives, so probably the introduction is already there. And I do hope whoever is listening to this broadcast today has visited our website, our Twitter handles, Instagram, our YouTube channels, because we try and get you as much information as possible. I have been doing infertility since the past more than 22 years now. I started practicing infertility in 1999, being one of the first doctors in India to have done my fellowship in reproductive medicine, now, which is, similar to the degree that is required internationally in order to practice IVF. Today, I'm going to be speaking on a topic which is actually very close to my heart. It is also because I truly believe that prevention is better than cure. The talk today is on social egg freezing, mainly for all women out there, of course, their families, husbands, brothers, friends, for everybody. This is a topic which is close to my heart because I feel that as of today, even today for that matter, most of the people world over, and especially in India, are completely unaware about the facet of social freezing. So, before I start and I go into what egg freezing is all about, I think I would like to start with a disclaimer. And the disclaimer is that this broadcast or this topic is not at all to try and tell people that IVF is a better option than natural pregnancy. Far from it. But this is something that every woman should know. So, you have to look at it as something exactly like how you take a health insurance. So, neither are we trying to say that women postpone your pregnancies, not at all. Neither are we trying to say that freeze your eggs and go through a pregnancy only by utilizing IVF, not at all. Neither are we trying to say that delay your pregnancies, and it doesn't matter if you get pregnant at the age of 40 because you've frozen your eggs, not at all. What I am trying to say is that there are many women today who are delaying childbirth, and that's the fact of the matter, not only in India but worldwide. And what we do not realize as women, as we are climbing our ladders of success, climbing the corporate ladders, studying more and more, or probably not having found partners that, we may feel we are compatible with, whatsoever the reasons, we do not realize that our biological clocks are still ticking. And the ovaries are aging day by day, month by month, year by year. And by the time we come to a stage where we would really like to embrace motherhood, probably the ovarian reserve is very less, which means that the number of eggs that a woman has in her ovaries has decreased to quite a large extent. So, in order that we do not face a situation like this, could we explore the solution or the possibility of freezing the oocytes just in case you require it at a later point in time? So we need to look at it like a health insurance. All of us make sure that we maintain our health. All of us do everything in our capacity to try and make sure that we do not really fall sick or have any major hazards to our health. At the same time, always taking a health insurance, because you never know what happens. So that is the way one should explore and look at social egg freezing, because fertility for mankind, I mean, men, women, everybody, is just as equally as important as health. having children, having relationships, being able to enjoy parenthood is such an integral part of being healthy also in that term at times, as per what you wish. Maybe some people may not want to embrace parenthood, and that's perfectly all right. But most of them and most of us who would probably want to do so need to understand that small percentage risk that there could be a problem with losing oocytes. We need to get prepared for this. So this is the disclaimer or the whole background of talking about social egg freezing. So now let's just get on to social egg freezing. And let me share a few slides, and then I'll come back again. Very few slides, so quickly, just so that you'll get a fair understanding of what I'm really trying to bring across to you. So the question is, why freeze eggs? So what are eggs, right? Eggs are the gametes that the woman has. Sperms are the gametes that the male has. So the eggs or oocytes are present in the ovaries of women. Now, there's a lot of people, there is like Facebook, Google, etc. They actually encourage their employees to consider egg freezing. And the question is, why should you freeze your eggs? Now, what you need to understand is that when it comes to the ovarian reserve, or the number of eggs that we have in our ovaries, time is not our friend. So fertility and fecundity decrease with age. And exactly the reverse is happening, that increased number of women world over are delaying childbearing. So the average age at which a woman is probably planning childbearing is increasing. And at the same time, fertility and fecundity is actually decreasing. Both put together, it's quite obvious that women at an older age are going to have more and more difficulty getting pregnant. Now, why does this happen? It is also very important to understand why this happens. Most of the times, even today, when people come to us for IVF as well, they think that it's a matter of one egg, right? You need one egg, you need one sperm, and you need one embryo, and that'll make a baby. Well, it doesn't happen so. Nature has given millions of sperms to men and lakhs of oocytes to women, and there must be some reason behind it, because not all gametes, similarly, which in female would be the eggs, are good or are capable of giving a pregnancy. And as age progresses, the quality of the oocytes or eggs keeps on decreasing. This is because the DNA structure, or the chromosomal, the whole matrix of the chromosome and the interaction between the egg chromosome and sperm chromosome changes and kind of gets into a state where abnormalities are common as the woman ages. So if you have a woman who's less than 35, a queen and fertile woman, or if you look at egg donors who are like perfectly fertile women, you barely need about 5 eggs to give one pregnancy. So one good normal euploid embryo. But as you can see from this slide, as the age increases, you need more and more eggs to achieve a singleton pregnancy, because the oocyte quality is decreasing. Now, this is a double whammy, because as age is increasing, the number of oocytes are decreasing, but the number of oocytes required to give a pregnancy are increasing. Now, how does this woman balance this? She has lesser number of eggs, but she needs much more eggs to give a single pregnancy. Whereas when you're younger, you don't need as many eggs, but luckily you have a lot of eggs present at that point in time. So this is what happens, and fertility decreases. Now, another very, very common graph that we use is to show what is happening as age increases. So fertility is decreasing as age increases and drops to nearly zero when you're close to 45, and the risk of abortions is increasing as the age increases. And all this is happening because of poor quantity and quality of the eggs that is present in the woman. Now, what another very important thing, and we have a YouTube video on this, is about the ovarian reserve in the Indian women, the Indian subcontinent. Now, Indian women are aging reproductively, their ovaries are aging much faster than their Caucasian counterparts. So, the fertility of an Indian woman at 30 matches that of a Caucasian woman at 36, in the sense the reserve, the ovarian reserve, we are 6 years advanced. So we are losing those 6 chronological years of our life to a decreased ovarian reserve. So when we talk about the age 35, 36, probably our women, even at the age of 30, 31, are having a lower ovarian reserve than women, compared to the women who are Caucasians of the same age group. This is an added factor for women in the Indian subcontinent, or the Indian ethnic Indian women. So that is why thinking about egg freezing becomes all the more important, even in our country and for our women. Now, like I said, the oocyte abnormality is increasing with age, exactly similar to that. So as you have, as you're aging more and more, like you can see on the Y axis, we have the percentage of abnormal oocytes. So the abnormal oocytes increase more and more as the age progresses. Now, like I said, age is the most important predictor of reserve. But of course, there can be other markers, because even young women can have sometimes a low ovarian reserve. And that we come to know only if we are testing the ovarian reserve. Another very important thing, and commonly people make a mistake about this, is that it's okay, I can, maybe have a child later because we have IVF now. But it is important to understand that ART cannot overcome age. So when we practice assisted reproduction, we still are not able to counteract the effect of age on the success rates. So even today, the success of ART is dependent on the age of the woman, because the younger the age, the more the number of oocytes and the better the quality of her oocytes. And in women with a decreased ovarian reserve, or as they age, at times they tend to require donor oocytes, because they cannot have, or they do not have enough reserve or enough oocytes left in their ovaries. And that's the point in time that you have to either use donor oocytes, or luckily, if you have frozen your oocytes before, then you can use your own frozen oocytes. And that is what is the topic today, about social egg freezing. So what is social egg freezing? Social egg freezing is done when voluntarily women want to freeze their oocytes for whatever reasons. They may be not planning a pregnancy right away. They may be, not having found partners right away. They do not know when they want to embrace motherhood, but they would want to do it at some point in time. But at this point in time, there is no male gamete available, because usually if a woman is married, then we counsel them for embryo freezing as well. But oocyte freezing is a voluntary acceptance of ensuring or freezing the eggs that a woman has, which can be used at a later point in time whenever they contemplate motherhood. Oocytes can be frozen for as long as you want. Basically, once you kind of freeze these oocytes, then they remain in that frozen state till you thaw them or till you warm them and use them for fertilization with the sperm, making embryos which can then be utilized to have a pregnancy. So basically, this is a process in which the eggs are taken out and they are put in liquid nitrogen and frozen for as long as the woman would like this to be frozen. Now, why did oocyte freezing take some time to become more acceptable. Basically, this is because a very important thing we have to understand is that the egg of the woman, the oocyte, is one of the biggest cells in the human body. And there's a lot of cytoplasm in the egg, and cytoplasm has water. So whenever we used to use a method of slow freezing, this water in the cytoplasm of the oocyte, there would be formation of ice crystals in the cytoplasm. And when you would want to take these oocytes out of the freezing, then whenever these ice crystals would kind of start dissolving, it would cause injury to the oocytes. And this was actually not giving us good number of oocytes that we could retrieve back, that we could salvage. Because if you're freezing oocytes, we should be able to get intact oocytes when you want to use them so that they can be used for the further process of IVF. So this was the problem with egg freezing initially. But now we have a process called vitrification. So vitrification is something which is a very fast freeze mechanism in which the freezing, it goes from room temperature to minus 196 in a matter of seconds or minutes. And that is why it prevents the formation of ice crystals. And hence, when we retrieve or we thaw these oocytes, we get a lot of good quality oocytes that we can salvage after this process. And it has been found that the pregnancy rates from vitrification are equivalent to the frozen embryos that were frozen. And it is not any longer considered as investigational either in Europe or even by the American Society. So this is not my slide, this is just a courtesy. But if you can see, basically what's happening is this is like slow freezing. You're coming from a temperature slowly, getting this, where we get the oocytes from this temperature directly. I mean, this, I know it's still cold, but from a room temperature to a much colder temperature in a matter of seconds. And that is what we call as vitrification, which has helped us to get and salvage good oocytes after getting them out of the vitrification or the freezing. Now there was a point in time where this egg freezing was not really available to the masses. It was still considered as experimental. It was still considered under research, still considered as investigational. But all the the IVF societies and the reproductive medicine societies like the European and the American society, etc., have lifted this experimental tag from oocyte freezing. And because now they have seen that a lot of oocytes can be recruited and salvaged, and there have been a lot of pregnancies and a lot of healthy children being born out of the oocytes that were frozen and utilized later for a pregnancy. So this is what is the whole concept of freezing your eggs. But what is the process of freezing your eggs? So what happens if you do decide at some point in time that you want to freeze your oocytes? What is done is that you would get into a reproductive medicine unit like ours. We would assess the patient, understand what is the ovarian reserve, what is the number of eggs that this woman has, what is the age, what are the kind of drugs that will give her the best quality and quantity of oocytes. Once that is determined, we start the ovarian stimulation. So injections are given as they are given in the IVF process. And these injections are given to make more and more eggs, because remember that we need many eggs ultimately to give even a singleton pregnancy. So these injections are given to make multiple oocytes. Once the multiple eggs are formed and they reach a state of maturity, under a small general anesthesia, the oocytes are retrieved from the follicles, retrieved outside the body. These oocytes are immediately sent to the IVF lab. The embryologist has a look at the oocytes. The mature and the immature oocytes are segregated, and the oocytes are then frozen with the process of vitrification, which I have just explained to you. Once these oocytes are vitrified and kept at a temperature of minus 196 degrees in liquid nitrogen, they remain in this state till you decide to get these oocytes out of the freezing process and out of the cans and the cryopreservation, and utilize them for making an embryo in order to have a pregnancy. So this is the process of oocyte freezing. It is not really a very difficult process. Yes, a woman will have to take injections, will have to go through that short anesthesia, but there is no cut involved. There is no major surgery involved. It is just done by just retrieving the oocytes with a small transvaginal ultrasound probe. So a short process is required for this whole step. But what happens is that you get to preserve your oocytes and you can utilize it at any point in time. A very important thing to know is that they have found no differences in the abnormality rates, implantation rates, pregnancy rates, and live birth rates between groups. The overall abnormality or the anomaly that, people are always worried that if I use IVF, what will happen? Will there be abnormality in children? So if you're using frozen oocytes, will there be abnormality in children? No, the overall anomaly rate was just about 1.3%. And we have to understand that even people who conceive naturally, there is an anomaly rate even in their children. So this anomaly rate with oocyte freezing nearly matches us hardly anything over and above what the normal or natural born children would have an anomaly rate. More than this is a little old, obviously, but a lot of babies have been formed and no anomalies have been found or have been noted. But of course, we need, and there will be more and more registries as we go along the way. So when do we use oocyte vitrification? Like, for people, young women who have cancer, many times before cancer treatment, their eggs are frozen. But today we are talking about elective and social oocyte freezing. So young women, young girls who decide that, probably I do not know when I would get married or when I would plan a pregnancy or when I would meet a partner of my choice, but I would rather freeze my oocytes at this point in time. They are the ones who can consider oocyte vitrification. And another very, very important thing which I want to bring out is that, especially women, there are certain women who are prone to have a premature menopause. Like if there is a history of premature menopause in your family, like maybe your mother, aunt, sister have had very early cessation of menses, or there are certain genetic problems in the woman, like Turner syndrome or mosaic Turner syndrome, which is a genetic abnormality where the woman loses her eggs very fast, or a fragile egg syndrome where again the woman loses her eggs very fast. So it's not just about having less eggs in the ovary. There are certain conditions like even diabetes, for example, where women tend to have a lower ovarian reserve. So under such conditions also, it might be prudent to think of the option of egg freezing, because what number of eggs you have today, definitely you're not going to have the same number a year later and a year later and a year later, because every time when you menstruate or when there is ovulation, 100, 200 or as much many eggs are utilized every month. So by default, every woman is going to have a loss of eggs from her ovaries every month, and nobody can really stop that. So now for women who have a low reserve, for women who do not know when they want to plan parenthood, and for women who are at a higher risk of probably reaching menopause early, definitely this is an option that they must think of and consider. these oocytes are stored in the IVF laboratories, in the cryopreservation room, and they can be available to use at any point in time when you would want it. So at Zenith, we really specialize in egg freezing because we've been doing it for a very long time for many of our patients, for different reason. For every patient, it has not been just for delaying a pregnancy, but there have been women whose partners have not been with them while they want to plan a pregnancy, or they need IVF but they didn't want to wait. Now, initially, when we used to use sometimes donor oocytes, they used to be frozen oocytes, which we don't do now because the laws have changed. But we have been doing egg freezing for a very long time, which not a whole lot of people do, and we have really excellent results. So this also, because many times when I visit different ART specialists outside of India, and we talk, and I hear a lot of them speaking about advising this to their own daughters, nieces, relatives. So especially, I think people like us who are on the other end of the table, who know what's happening with the reserve, are becoming more and more inclined to at least bring this knowledge to everybody, so that, if you don't know, you will never know that there is an option. So you should at least know that there is an option so that you can explore it if need be. Now, social egg freezing is becoming an increasing area of interest and application. There are unanswered questions, yes, and there will be, as with any new scientific development. There is going to be a question of who should freeze. The question is, why not everybody? I mean, as many people as want to can freeze their oocytes. It does not mean that just because you have frozen your oocytes, you can avail of a pregnancy only through IVF. Most of the times, these oocytes are only used as a backup. So even if you do freeze your oocytes, you must try and conceive naturally as far as possible. But yes, due to some reasons, if you cannot conceive naturally, if the ovarian reserve has fallen by then, or if the age has advanced to a point where these oocytes as of today are going to be much poorer in quality compared to the oocytes that you had frozen years back, then that is a point in time where these frozen oocytes can be utilized. It's a balance between waiting too long and an unnecessary procedure. There has been a debate, over why should you freeze oocytes, or, like you are recommending and you're forcing people to delay pregnancies, and, making them feel that if they just freeze their oocytes, then they can, delay their pregnancies as long as they want. And that's the reason I started with the disclaimer that this is not at all to advise young women out there that delay pregnancy or don't conceive naturally. Not at all. This is only a fallback option if need be. But remember, this will give you the option of having your own biological child. That is what everybody struggles, even as of today. I have seen people who have to choose the option of using donor gametes, be it donor eggs or donor sperms, and it does pain them. Of course, once you embrace it, it is all out. I mean, adoption is wonderful, donor eggs is wonderful, everything is wonderful. Ultimately, it is experiencing the joy of parenthood. But the innate desire is to try and see if you can have your own biological child. And this is one procedure that can help you achieve that goal, even if for some reason there is a delay in your childbearing. Now, again, like I said, there are many questions. What is the optimal age to freeze? The younger, the better, right? How long are frozen eggs good for? As long as you keep them frozen well in the cryopreservation room with good embryologists monitoring them. How old is too old to use eggs? Each country will have, an age limit up to which a pregnancy or motherhood will be allowed through ART methods. And that would be the point in time till when you can use these oocytes that you have frozen some time back. Another thing also we need to understand is that you will need a lot of oocytes to be frozen. Okay, like we see that as age increases, you will need more and more eggs. So the younger the age at which you freeze your oocytes, the lesser the number of oocytes you will require to achieve a live birth. And that is why freezing oocytes at an optimal age is again important. Another mistake that people do is thinking that, okay, now I'm 36 and or 37 and I still don't know what I want to plan, so let me freeze my oocytes now. Fair enough, good decision. It's better to freeze at 37 rather than go on to 40, 42 and then have a further decline in your ovarian reserve. But would 30 or less than 30 would have been a better option than 36 or 37? Definitely. I mean, there's no denying that. So, what age is optimum is for each person to decide and try and understand, whether this option is something that we would like to avail of. Success is still age dependent. At the age of 25, if you freeze 6 oocytes, you will have more than 40% chance. But same number of oocytes as the age of 35 will give you only a 23% chance of live birth. There's been a small study on follow-up of bankers and non-bankers, that is women who have banked their oocytes and women who have not banked. And what they found is 76% would have preferred to have frozen their oocytes at a younger age. 10 to 20% of the women who did not bank regretted that they did not bank their oocytes. 45% would have banked if cheaper, and stuff like we say, as more and more it becomes common, it gets easier for people to financially avail of the new scientific advancements. 96% said that they would recommend it to others. That's a huge number. So definitely women who are freezing it are seeing some value in it. Otherwise, you would not get 96% of women who froze their oocytes recommending others to freeze their own oocytes. And women are usually happy with their decision to have frozen these oocytes. So I'm done with my slides. So this is just a short overview of what egg freezing is. Like I discussed when I talked about the low ovarian reserve in the ethnic Indian population, women, I said that it is something that I won't say close to my heart, but something that I feel for, because I really feel that women should know what is happening to their biology, to their reproductive systems, because only if you know will you get empowered to take certain decisions in life. And the best thing for women would be to understand the biological clock, think and try if they can complete their parenthood earlier, especially if they have a low ovarian reserve, by all natural methods. But if not, and probably the indications are only going to keep increasing, consider the other options that science has available as of today. So this is all about social egg freezing. I would be very happy if you could write down your queries, send us your questions, send us anything that you have on this matter. Talk to your friends, discuss with friends, discuss amongst friends, discuss the pros and cons. I mean, there has to be a debate, right? Nothing good can come out if we just remain silent. So have debates, absolutely no problem. Pose your questions, but at least not just not think about it. I think it is important to think about it. Whatever you may decide is a separate thing, but giving it a thought at least will make you feel that I gave it a thought and I took an informed decision that to do something or to not do something. But regretting that you didn't give it a thought or you were not even aware of something like that would cost some women the chance of having their own biological child. So thank you so much for being with us today. And this is a short kind of a discussion. And please do follow us on our website, our YouTube, Instagram, Twitter, Facebook, all these handles. And please do write to us. Our email is info@zenithivf.com. Zenith is with an X. It is Xenith. And also you can send us your queries on our emails, on our, you can call us, you can come meet up with us, you can pose your questions here, and we'll make sure we get back to you on anything that you have to ask or discuss. So thank you once more. Have a lovely weekend, everybody, and I hope to see you again soon with another topic that we will bring for you. Thank you.